If you create new design of machine, not forget about two important regulations. In every kinematic scheme, we can apply forward movement and we can apply revolving movement, and we can apply combination of revolving and forward movement, including of the impulse movement. For create design, we have useful diagram, and you can see this diagram. This diagram have 6 taxons for create of new machine. Revolving movement obligatory exist, and you can see Mamatome knife with revolving movement, and different version in the market exist, but obligatory exist knife with forward movement, and you can see one version, but commonly the people use this version of the movement. Obligatory work principle 13, you can to do opposite, inside, outside, change to place. And you can see shooting Mamatome knife, shooting Mamatome knife with some spring.
There are 3 key steps to a vacuum-assisted breast biopsy procedure using Mamatome EX: setup, biopsy, and marking. Mamatome EX Setup. Mamatome EX enables quick and easy ultrasound biopsies because the device can be set up in 3 simple steps. Place the canister in the control module and connect the vacuum tubing. The vacuum tubes come pre-connected to the probe. Attach the ergonomic holster to the device and connect the holster cord to the black port on the control module. Turn on the control module. After performing some diagnostics, the convenient touch screen will prompt you to select the default procedure settings or previously saved custom settings. After only about a minute of device setup, you're ready to perform a biopsy. Mamatome EX Procedure. Scan the breast with an ultrasound transducer to locate the lesion. Clean the breast, anesthetize using both a skin wheel and deep anesthesia, and make a skin incision. Press the position mode on the Mamatome screen and press the forward button to close the sample aperture. Insert the needle into the breast at an angle to the transducer and position the sample aperture under the lesion. You may want to drop your elbow to lift the lesion. Press the sample mode on the touch screen and select the auto sample mode. The cutter retracts and the ring down effect can be seen. The lesion, aperture, and ring down are all evident on one ultrasound image. You are now ready to acquire tissue specimens. Press the forward button on the device to take a tissue sample. As the cutter reaches the distal end of the needle, rotate the handpiece to the next sample position. The tissue sample is readily retrieved from the open access tissue collection chamber. Multiple samples are easily obtained to facilitate pathology. MammoMark Deployment. The MammoMark biopsy site identifier places a sonographically visible absorbable marker with an embedded titanium clip into the cavity. This enables short-term sonographic identification and long-term follow-up of the biopsy site. Easily identifiable alignment indicators ensure proper device orientation and insertion depth into the Mammatome EX device. The ramped tip of the MammoMark deployment window ensures consistent marker deployment. Insert the device into the Mammatome EX probe with the black triangle oriented in the 12 o'clock position. The alignment marker ring should be flush with the probe entrance hole. The smooth action of the MammoMark plunger deploys the marker into the biopsy cavity. Rotate the Mammatome EX and MammoMark 180 degrees and remove both devices from the patient. The collagen-based marker expands within the biopsy cavity, centrally positioning the titanium marker at its center. The Mammatome EX probe and MammoMark biopsy site identifier, bringing new levels of speed, accuracy, and ease of use to vacuum-assisted breast biopsy.